Hello everyone present here. This is Apurva from Mom's Belief. I hope you all are safe and well. Today we have Mr. Rayaton D'Souza. He is a speech language pathologist at Mom's Belief IFATA. He is working as associate professor for Department of Speech and Hearing at MAPS College, Mangalore University. He's having 8 years of experience specialization in autism and ADHD. His interests are in natural and Ayurvedic remedies. Also, he has worked in schools and rehabilitation centers. A very warm welcome, doctor. Thank you for joining with us today. Now, without any further ado, let's start this session. Over to you, doctor.
Thank you, ma'am, for the introduction. Good morning, everyone. So,
Good
can
morning,
I start
sir.
with the?
Yeah,
Yes.
please.
Okay. So we'll start with the topic, that is the science of speech therapy. The wide idea, when we think about this science, what is science and what is how the speech therapy overall, what I'm saying is it's about how the speech therapy is formed, or how the speech therapy is being at into the time of when we get this therapy, how exactly the things are happening. And most of us, the main motto of this program, this topic was when we, how to select the speech therapy and what are the main motives of this speech therapy in the cases, especially in the children with autism and ADHD, or any of the language disorders. When we think about this language disorders or speech disorders, then ultimately two things comes to our mind. The first thing is about the speech therapy, and the second thing is we think about occupational therapy. Yes, of course, the occupational therapy as well as the speech therapy is the main two things which mainly we focus, because every child has to speak. That is what all the parents are looking for, and every child should be independent, or it should be able to do the day-to-day activities on its own. So these are the very two areas, and where we are encountered, or where we are just looking for each and every time. And so today what I'm going to give you a brief explanation, a knowledge and an information, being a speech language pathologist, how exactly this speech therapy works, on what criterias. Okay. Yes. So let me start. What is speech? So our definition says speech is an audible. Can you get into the slide? Yes. Speech is an audible manifestation of language. Speech is very rapid, it is very complex activity, and requires very finely tuned muscle movements. Yes, the participants can see here the words like it is a very audible manifestation, nothing but oral, or what audible which we can hear. If something has to be heard, then it should be something which we has to orally or verbally we need to say something, then it has been heard. And speech for humans is the speech forms a language. That is a small idea what we should do. Most of us goes for this word saying that I'm going for a speech and language therapy, or my child requires speech and language therapy. But the speech therapy, why it is formed, it is a indication for the further saying that to learn a new language, speech sounds or a speech is required. Now, when we say speech, speech is nothing but the sounds. And when these sounds are combined together, we'll make when the speech sounds are combined together, we make the various syllables. Syllables are joined to form a word, and that is how the language has been formed. And the language gives you idea about the areas of learning the meaning, each and every one, which I can which and everything, sorry, which I can explain in the further slides. And the speech is very rapid. It says it is very rapid, and it is a very complex activity. So learning the language speech is not that easy. It is very rapid, it is very complex, and requires a very fine-tuned muscle movements. The muscle movements, that is when we think about the speech therapy, most of us will encounter about the oromotor exercises. So why these exercises are important? Because the definition itself says it is a very fine-tuned, it's a muscle movement activities. where the stimulations has been sent from the nerves, and then the output, that is the speech, is being formed into a language. Okay, so next slide. Yes, that is about the language. It says language is nothing but a particular code of ideas, which is represented through conventional system of arbitrary signals for communication. So if he has to communicate, and there should be some language. Okay. And the language can be of anything, a verbal language, it can be a non-verbal, it can be in the form of like gestures or signs, etc. So this code of ideas, which is been encoded in one particular thing to make it a meaningful words, and that is something called as a language. Some signals which is used for the signals which are used in the language for communication makes a language. Now, for example, when we are learning a new language other than our mother tongue, for example, let us learn English. First thing, we teach the English sounds, all the sounds of the language first. Then we'll teach them to combine the sounds together and form a language. Okay, then what it has been said is, it has been said that uh, it is a code of ideas which is represented through conventional system of arbitrary signals for communication. So it is very clear, speech combination makes a language. The language, after the language is used for a communication. Next slide, we can go. Yes. Now something about, now what is the speech therapy? Once when we know about the speech, language, and how the communication takes place, then definitely yes. When the requirement comes that my child is not having a speech, or my child is undergoing with some of the disorders, or when we encounter all these things, then we get this idea about, we want to know the idea about what is speech therapy. Okay, it is very clear. It is something, a speech therapy is nothing but a treatment, or also we can call it as a, it is an intervention. But I can make it clear that it is also a service. Okay, it is not something which everyone can take it from everyone. No, anybody cannot take from any person. It is something, a treatment which is been given in the form of a service that focuses on improving a child's speech and abilities. Here what it says is, it is not something like a medicines which you can say that okay, my child requires a speech therapy, take this particular speech therapy and everything is fine. No, it requires the knowledge, the information, and we need to work on it. That is what I wanted to make it clear for everyone. When it comes to the speech therapy, it is something which we everyone work together. The role of the parents, the role of the speech therapist, or the therapy centers makes other therapy clinics, that also makes a major role in the development of speech therapy, or to give a progress in the speech therapy for the children who requires. Okay, it is an intervention service that focuses on improving a child's speech and abilities to understand and express language, including the nonverbal language. So the speech therapy, what it says is, it focuses on the areas like, mainly like, a speech therapist will work on the voice of the child, the fluency, how fluent the child can how fluent the child can get into, how fluent the child can be in a speech, and the articulation. Okay, articulation is the production of the sounds, how well the sounds are produced, how clear it is. And the voice is very important. Without voice, there won't be any speech. Whereas the speech therapist, as it has been mentioned, even if they work with a non-verbal language in the conditions when the child is not able to speak at all. So most of us have a confusion, because speech, when we go for a speech therapy, we have seen our children are taught to point out to the particular flashcards, or particular books, where they has to ask the pitch, what is, where is dog, and they has to point out children. So this is kind of a non-verbal language, and when this kind of a language is being thought is initially when the in a therapist wants to clear that whether the child's understanding level is up to the mark, to make the child to know whether the child is able to understand the cognitive areas. In that case, speech therapy, in a speech therapy, a speech therapist will see for all this kind of non-verbal gestures, whereas the non-verbal language is being taught to the child in the case where the child is not able to verbalize at all in certain conditions of the anatomical or physiological conditions, along with some of the when it comes to the language disorders, non-verbal autism. So preferably, as to my practice, it has been very clear that when we work on non-verbal communication, or when we give a speech therapy on non-verbal, is only after 12 to 13 years, where we are very clear that the child is not able to speak at all. So till then, we try our maximum to give a speech therapy for a verbal output. Okay, next slide. Then we have this when we learn the language, when we learn, this is language components. Okay, language components is nothing but when we learn a language, or when we want to learn a new language, the certain concepts are very important, the certain components of the language are important, and the first thing is something called as morphemes. Very scientifically we call it as a morphology. That means the study of the smallest unit of sounds. And then we have this phonetics, or I can make it as a phonology. Scientifically, we call it as phonology, which is nothing but the study of sounds in a particular language. Then we have semantics. Semantics is nothing but learning the meaning of a words in a language. And whereas the syntax is a grammatical form, or a syntax is nothing but learning a language in a grammatical concepts. Then we have a pragmatics. So all the language through the morphemes, phonetics, semantics, and syntax, what we have learned, then now the language has been learned for conversation or for communication, and that the social use of the language is nothing but pragmatics. Okay, let me explain how this takes place. First thing is, like, now let me choose a language, that is English. When I want to learn a language called English, that is first thing I want to learn the smallest unit of the sounds of English language, and that comes under the area of morphology. You can please make a note on this. It is very easy for us to rate when we go for a speech therapy centers, or when we go for a speech therapy. It is very easy for us to rate all these areas of morphemes, phonetics, or semantics, how it works, and how the language learning takes place. Okay, so yes, morphemes is nothing but, as I said, it's the smallest unit of sounds in a language. So this morpheme, like for example, now when I have to learn a language English, now there is something called as p. P is a phonetic sound which has a combination of consonant and vowels. But here now again the smallest unit, that is p. Okay, that is how I can make you understand in a simple manner. The concept actually doesn't go in that manner, but how can I make you understand that we call it as a smallest sounds. There is no combination of vowel consonant in the morpheme level, whereas only the consonant sounds are produced. Okay, like k. If it is ka, then it is consonant and vowel combination. Okay, immediately when we have been learned with this kind of morphemes, then we go for the areas of phonetics, that is phonology. Here this phonetics plays a major role in the production of sounds. Okay, so what is happening in the phonetic, or in the phonological area, is when we learn the language, now here we are teaching all the sounds which comes in a particular language. Now for in a English language, we have a sounds from A to Z, that is from A to Z. Okay, so we teach them from A to Z all the sounds. Okay, when we teach these sounds, we teach through the activities, or through the pictures, through the through the common objects, through the items. We teach this for the kids. Why we are teaching this is, it is very easy for them to understand the concept. For example, now we are showing we are having an apple, and we show that apple and we say, ah, ah, apple. We have an elephant, and we make it clear that a elephant. And we have fish, then we say for fish. Okay. So what this concept goes, or what this encodes for us, is in our mind that something called as fur makes fish. Something like apple, makes, sorry, a makes apple, banana, whatever. So this wise, we are teaching the phonetic sounds, and these sounds are when we teach the language, all these sounds are now combined to form a syllables. For example, ka is combined with vowel a, c, ye, ka, a, cat. This makes a syllable. And now we add one more sounds for this, that is t, ka, a, cat, t, cat. And that is how we form a word. And when we form this word, that is nothing but we are saying that ka, a, ka, tu. It is just a sounds, and now we are giving a meaning for this sounds. Cat, tu. Then immediately we show a picture of a cat. So now the child is able to understand that yes, the cat is there, and this is something. This image is something called as cat. And then we give the description of the cat, saying that cat says meow, cat says, all those things are described about the cat. Cat is an animal, cat is a pet animal, or whatever. So this is happening in the stage of semantic level. Okay. And then we have this level of syntax. Syntax is once when we have learned in the semantic level the meaning of all the words. Here in the form, in the syntax area, we are teaching the children first, and the very foremost is to make them the opposites. We are teaching them which is soft, which is hard, which is uh, big, which is small. That is the first is something called as opposites. Then we go for the action words. We teach them action words like jumping, sleeping, running, eating, drinking, etc. So what is happening in the level of syntax when we learn this is the child is able to form a small phrases when from the syntax semantic level to the syntax level. When you come for action words and the opposites, the child is able to now form a saying that boy jumping. Jumping is action word, and boy has been learned in the semantic level. Boy jumping and bed. So these two, a small phrase, boy is jumping on bed, is being formed, and the development takes place in the syntax level. And immediately after action words, we can go for a prepositions. Then prepositions we can slowly shift into singular, plurals, then tenses. Okay, now at the area of tenses, a child is able to form like boy jumped into the well, boy is jumping into the well, or boy is jumping on the bed. Sorry, uh, boy is sleeping. So this kind of a small places and sentence is able to form when we teach the areas on this syntax. And once we are finished with the syntax and certain basic levels of syntactic syntax, then slowly we can shift into a description of the pictures. Like, look, we can show the pictures for the child and ask, like, what is cat doing? Cat is sleeping on the mat. So the child is able to describe. So this description, and once when this description is get, then we can go for a small, simple story narrations. And once this narration, slow story narration is a next step for makes a next step for the child to learn the conversation. And once when this narration takes place in the level of the syntax, then it is whatever the language we learned is for the pragmatics. That means to use it in a social level, social use of language. Is it clear to you all? Yes. Next, we can go for a next slide. Okay. Yes. Then we have something called as a pre-linguistic language development. Linguistic and language, both the words are same. Pre-language development, or if you want to learn something, um, before learning a language, what is the development takes place in a child? Okay, it's very clear what to say is Pre-linguistic means before learning a language or before learning anything, what what are the developments takes place is that. Okay, now soon after the child is born, as we know, the first thing what the speech sound what the child makes is a speech cry. And from here is the decision what we take place, whether the child has a good whether the child is having a speech or not in most of the conditions. Then we are literally worried if the child is not crying soon after the birth, then most of us have seen that, we worry, oh, child has not cried, all those things, and that is an indication for us saying that child is getting into a speech. Okay, that's the first sound what an individual makes soon after the birth. That's called as a vegetative sounds. And we have this something called as vocal play. Small kids at the age of 0 to 3 years, 0 to 3 months, the child keeps playing with the sounds, vocal sounds. Vocal sounds are nothing but the vowel sounds, like this kind of a sounds. Uh, so sounds the child which plays with the vocal, which is usually seen at the time of 0 to 3 months. Then later on, after 3 to 6 months, I can say you can see the child who coos as well as babbles. Okay, and then we have this babbling level. Babbling is where the child combines the various sounds and tries to make this babbling is, I can give an example of when a child makes mum, 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 mum. So what we think is, yes, child is calling his mother. Definitely no. Yes. Then what we do is we give a semantics. That is why I explained to you in the previous slides what is semantics. And we, the parents or caretakers, give that kind of a stimulation or a meaning for that babbling sound with which the child makes. Let me explain you once again. Babbling is the child keeps playing with the sounds, consonant and vowel sounds. Example, ma, 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 ma. And immediately the parent, a mother, comes and says, oh, mama is here. See, mama came. So now the parent is giving a meaning for the sounds which has been uttered by the child. This takes place in the semantic level. Hope it gives some sense now. What is the semantic level is the parents are giving the meaning, so called as mom, mom, mom. When the child is playing with the sounds mom, mama, we are giving the meaning, and the child therefore relates that particular mama sound for mother. That mama in a particular language, we give a meaning saying that it is a mother. Okay, that is how it takes place. Yes, we go for our next slide. Can we go for the next slide? Yes, yes, yes. Yes, then we have the speech and language development at what age the child is able to do and a particular sounds. Okay, that is how we can rate, how the parents itself can rate at what level the child is, whether the child is getting into the stages of delayed development, all those decisions we can think of. And preferably you might have been encountered when you might have been come across when you have been gone through the speech therapy assessments. Most of the you and during the assessment they ask for at what age the child started walking, at what age we started, what age the child had a first word, at what age we could say that the child was, whether there was a first cry, birth cry, etc. So if this gives us a small wide information about yeah, sorry. So this gives us some of the basic information how we can learn the language or the development, speech and language development takes place. 0 to 3 months, it's a cry. 3 to 6 months, the child babbles. Babbling is nothing but, again, I'm saying you, it's a combination of vowels, consonant and vowel sounds. Then we have this from 6 to 12 months, you can see the child coming out with with a few words like mama, papa, where the child combines the syllables and tries to come out with the words. And then at this level, most 6 to 12 months, where the language learning takes place in a very strong manner. So because at this stage, when we say that the language learning takes place, then what is required from our side is the absolute strong stimulation for the child. And if this strong stimulation fails at this time, that particularly from 6 to 12 months, that means when the child is playing in this with the sounds, and we are failed to give that stimulation, or we are failed to give that meaning for the sounds, whatever the child is trying to do, or the child is babbling, then there we can suspect some of the delays taking place. So that is why I call this is a strong age for the learning language takes place, 6 to 12 months. Then we, from our side, we need to give a strong stimulation because it's a word level stage. Next, we have this from 12 to 15, that is from 1 year to 1.5 years. The child is able to form, the level age stage is the formation of word. The child forms the word, means the whatever you say is mama, mama, and you give the meaning for that word, saying that I'm your mama, or papa, papa, and I'm saying that I'm your papa. Now the child is trying to form that word for the requirement of the child. For example, if the child wants to call mama, now that mama, the child is trying to call mama, the child is forming in words in his or her vocabulary. Yeah, next we have this 15 to 16 months. Yes, 15 to 18 months, around 1.5 year. uh, what happens here is you can see some of the changes in the child's voice. So I can recall the first few slides. uh, for a speech, there is a requirement of a voice, fluency, and articulation. We require a fluency, voice, and articulation. Whereas what is happening from 15 to 18 months is the intonation, the pitch, and the loudness takes place. The way changes in the intonation, pitch, and loudness takes place. The child's speech will be little loud. There will be a variation in the pitch. You can make out. Okay, usually the children's up to the age of 6 8 years, we cannot make sure that the pitch will be always a high pitch, but there will be a slight variations in the pitch along with the intonations. Intonations is nothing but the rhythms, or the how the child's the tone of the child also changes. When we say the tone is, tones are of many. Most of the kids will have a tone of there won't be any flow in the tone. It will be like a robotic flow or a robotic speech. Whereas at the that is how what are the changes takes place in the 15 to 18 months. Whereas from 18 to 2 years, then there the child takes place is a praises. That means the child combines one or two words, 2 to 3 words, and tries to form a simple sentences. This simple sentences takes place like this, like the requirement, the need of the child are fulfilled, saying, "Mama, want water. Mama, I want food," etc. So this simple sentences takes place at this time, despite of the continuous stimulation given to the child. And then we have from 2 to 3 years, we have a descriptive language. The child is able to describe the things in a simple sentences. The child is able to form in the describe the pictures. Then we have this time space and function relations. Okay, the child is able to discriminate morning, afternoon, evening. Then that and the functions, like for example, what we do with the plate, what we do with the glass. For example, plate, eating, glass, drinking. So this kind of activities I've been we can note in this kids at the age of 2 to 3 years. Okay, that is so this um, the child is able to look at the pictures and say, for example, looking at the pictures, the child is able to say that, okay, uh, baby is baby is sleeping. So, and the time relation concepts that the child learning takes place at this age. And after the next slide. Yeah. From 3 to 4 years, we have the sentence formation. Here, the child learns the tenses. Please keep this in mind. I have been seen most of the parents complaining, saying that at the age of 3 years, my child is not able to say certain sounds. My child is not able to understand if I say that I'm going to office and I'm coming in the evening. The child is not able to understand. See, here what that formation takes place is only the future and the past tense till the age of 4 years. Okay, the future and the past is being formed, but the understanding is not able to, because here the present tense is only the concept which we are able to which the child can understand, whereas the narrating or the singing stories like narrating and singing is the right time where this takes place. Okay, and from the 4 to 5 years we have this framed sentences. Child tries to frame the sentence. Child starts saying what is happening around the complaints, what is happening in the school, because this is a school going age. What has happened in the school, what has happened, like what activities have been done in the school, etc. The narration takes place in this time. Okay, so that is how. And I wanted to make clear in this by this saying that whatever the things have been mentioned, that at this particular age, that this particular thing should be seen in the child. It sometimes it varies depending upon the stimulation we gave during the developmental period. It depends even with the our culture, with our environment factors, like our religion, like which language we are teaching, because most of us, and at home we go for a bilingual, that is a two or three languages we teach the child. For example, we teach we some of our parents talk to us in mother tongue, whereas parents talk in a mother tongue, whereas some other family members talk in other language, English. Then there will be a confusion, and obviously there will be a delay when the child learns the language. Okay, so this is a wide, most probability is saying that at this particular age, this can be seen. So there is nothing to worry that, oh, my child is not able to form our tenses, or the child is not able to narrate a story. So absolutely, it depends upon the stimulation you give to your child. Then at the age of 4 to 5 years, the child is preferably able to frame the sentences. But again, I want to tell you that about the speech sounds. Most of the speech sounds, like retroflex sounds, what we call it as, sounds like ra, fa. Some sounds will be delayed in the children in most of the cases. So absolutely, there is nothing to worry much about. Yes, we can go for the next slide. Yes, there's a comprehension of the language. Very comprehension of language is nothing but comprehension is nothing but understanding. If anyone wants to learn, there 1 minute, excuse me. Yes, yes, there is a small interruption. Yes, the comprehension of a language is we understand the language. Okay, first thing when we learn a new language. Okay, in the slide there is a small error in the spelling mistake. Okay, yes. When we let's understanding of the language means language. First thing is that we should understand the language. Now, for example, when we want to learn a new language, for example, if I want to learn a new language, first thing whatever I learn is to first thing is understanding. We should understand. Now, what we should understand the basic commands in the language has to be understood. Now, what are these basic commands? E is come, go, sit, stand, keep, take. The basic, very basic, has to be understood. And that is what, if we have been seen in the speech therapy, first thing we ask the children, show me apple, give me apple. That is a very common thing. So uh, most of us will be very tired looking at this. Why? What is the point of asking them to show, give? I want my child to say that it is apple. Yes, that is a later stage. Expression takes place after comprehension. Try to understand. Expression takes place only if you can understand. If you are not able to understand, definitely the expression won't be able. There is no possibility of expressions without understanding. So what is now understanding is, first is a basic commands. As per through the developmental stage, let me explain you, tell you that at preferably what understanding takes place from 0 to 3 months is the recognizing the parent's voice. We can recognize the parent's voice. Okay, that is something understanding takes place in the child. And from 3 to 6 months, we shows the child shows some excitement for the sounds which has been which is occurring in the environment. For example, excitement at sound of approaching voice, the sounds heard in the environment, the child shows some reactions for it. The child might search for that sound. The child will also do the cooing if the child is really getting worried about the sounds at this 3 to 6 months. We'll go for next slide. Yes. From 6 to 12, there we have this response for the name call. Okay, when we call, we in Indian culture, we keep a name for the child, and preferably we call all the pet names for the child, Papu, Munnu, all those things. But yes, now what is this name? Which name? The name originally we original name or the pet names? That is again a question mark. Okay, that depends upon how we have been brought up with the names. So here the response, how the child responds, saying, yes, mama, I'm here. No, absolutely. That is not the response. Response is when you call, you give the child gives is the eye contact, or the child looks at you. The child says that yes, a child tries to come out saying, come out with the cooing or the babbling sounds, or the child crying sounds, etc. These are the responses. You cannot expect the response for the name call saying that, yes, mama, I'm here, or yes, papa, I'm here. Absolutely, that is not possible, because as we know, the 6 to 12 is just a word level. After 12 years, sorry, 12 months is 1 year, you can see a formation of words. Then later, after 1.5 years, a small phrases, later on with the sentence. Then the child is able to say, yes, mama, I'm here. So till there you can wait. So 12 to 15, we have simple instructions to understand the meaning of the words. Here, what is happening is again 1 to 12 to 15 months, the child is trying to, as I said, follow the simple commands, follow simple instructions, or simple tasks to understand. And the child here also learns the meaning of the words. Again, meaning of the words, when we call it, is the level of semantics in the language formation. Then from 1.5 year to um, sorry, 1 to 15 to 18 months, we have this learning concept takes place, like to make it whether the child is able to understand. We The child is pointing to the pictures, because sometimes the child, he wants the certain things, but the child doesn't know what to say for that. Yes, then when the child points to that particular thing, the picture or that object, so immediately we need to give a stimulation saying that, oh, that is a car or a whatever. Oh, that is a bus. So what now the child is start able to relate for that pointing object, saying that next time the child definitely will try saying, give me car, or will tell car in spite of pointing. Slowly the pointing fades. Pointing is a gestural language, so we don't entertain the gestural language, but pointing initially, it will be seen and it has to be taught to the child to show a verbal progress. When the child's understanding is able to in the form of a pointing, definitely we need to fade that kind of a pointing, and we need to give a verbal stimulation saying it's a car, and make the child to say car rather than pointing. So pointing and making it say it is car, it's also makes some sense. Next. Then we have from 18 to 2 years, 18 months to 2 years, the child is able to follow the or understand the two directional commands. And from 2 to 3 years, the concept of prepositions, very important, because when we learn this syntax, in the level of syntax in the components of the language. The first takes place, as I said, you the opposites. Then we teach them the action words. Then we come for the preposition. So you can see the time is from 2 to 3 years. The preposition takes place. For example, ball is under the table. A cat is sleeping on the mat. All those things. Cat is on the mat. So on, in, under, the preposition learning takes place at this. In that time, we can expect some of the small basic phrases, I can call it, as rather than a sentence with a child, in a child. The simple stories with the pictures, the narration skill, the description can be taken place at this age. Like looking at showing the pictures and asking that, okay, um, a monkey is on the tree. So the description takes place from 2 to 3 years, whereas the narration takes place later on. That is from 3 to 4 years. We have this why questions. Okay, here this why questions, child preferably ask why and what, where, and when is seen in the cases, whereas this the why questions are rarely seen. But I mentioned is why questions, but why is questions which is asked later on at the later stages of development. Okay, that is 4 to 5 years. Then we can see them, the kids sequence with the words, they combine the words. Then they will be a little aware about some basic humor or some of the jokes. Okay, basic jokes we can understand. If we say that, no, I just kidded, so at this age they can understand. If you say at the age of 2 to 3 years, no, I was just kidding, that absolutely the child is not able to understand what was that. So even in it depends, you cannot even expect at the age of 4 to 5 years the child understanding the jokes. It depends upon the environment. It depends upon how well the stimulation the child had been got during this developmental time. Okay, yes, yes, we'll go for the next slide. Then we have this pre-linguistic skills. Pre-linguistic skills is, if you want to learn something, if you want to learn a language, then the first thing is that you need to interact. You need to interact. Then you need to have a behavior modifications. Okay. Now, first thing is pre-linguistic skills. Now, let me consider when you take your child into a speech therapy center. The child first should interact with that environment. The child's interaction should take place with the environment, as well as the child's interaction should take place interaction with the environment, interaction with the speech therapist, interaction with the other team members, everyone, the interaction should take place. And this interaction will take place, it requires at least 2 to 3 days, believe me. There will be very difficulties. The child might show temper tantrums, the child will cry, the child will have all these cranky things, but that's okay, because child requires some time now to interact for the new environment from his house home to the speech therapy clinic or the center. Okay. Once when this after 2 or 3 days, when the child is get used, when the child is damn sure that there is no other option for me, coming to this therapy is a regular schedule, then the speech therapist will get into the therapist will get into some of the basic behavior modification. Now, what is this behavior modification? Basic behavior modification is the therapist will first make the child to sit in a place to learn. If you know our traditional method of learning, that is takes place by sitting. When we go for our classes, schools, first thing, the teacher, we greet the teacher, then the teacher asks us to sit, then the class takes place. See how wonderful the creation is, how it has been created, how wonderful the tradition has come up. Sit, and then the class takes place. Teacher is standing giving a class, whereas the students are sitting. Okay, why this sitting is important? This is very important to learn anything, to learn a language. For example, in our area, to learn a language, sit in a place is very sitting in a place is very important. So that is the first modification which we do or which we work. Now, without a child sitting in a place, whether the therapy is possible, yes, it is impossible. To learn a language, it is not possible. Whereas partially it might be possible in the level of interaction. But to learn a language, if a child is not sitting in a place, absolutely it is not possible. So these are the behavior modifications. Okay. Then some I just want to get into eye contact now. What is eye contact? Most of us have a very bad thinking saying that eye contact is nothing but when I talk to a child, my child doesn't look at me continuously. Or my one if I move a string around my child's eyes, the child doesn't keep on looking at that particular strings moving. No, absolutely that is not eye contact. Why I'm saying that is not eye contact, because at the age, very tender age, we can call it as during this developmental ages 0 to 6 or whatever the therapy the child is going on, you cannot expect the child to look at an object and sit for a long time unless it is very interesting, unless it is very attractive to the child. Please don't think that the child's eye contact is poor or there with by just showing one flashcard and asking them to see the flashcard. And if the child doesn't see the flashcard, saying that coming into a conclusion saying that the child has a poor eye contact. No, it depends upon the interest. It depends on how attractive the things are. Okay. Then I have also mentioned about the sitting behavior also comes under behavior modification. And then we have this attention and concentration. Yes, eye contact, attention and concentration works together. Attention and concentration works together, because if the child is able to have a good eye contact, the attention skills, yes, it shows that the child is also having a good attention skills. So this attention and concentration means we have seen that we give them an activity for a particular time and we see that the child finishes that activity. Then we rate the child saying that attention and concentration is good. The child is able to perform the activity for 2 to 3 minutes. Oh, sorry, 2 to 3 minutes is okay, but 10 to 15 minutes. If the child is not able to perform the activities continuously for 10 to 15 minutes, then absolutely we make a note that the child's attention and concentration is poor. No, absolutely this is wrong. Attention and concentration doesn't take place in that manner. Again, everything is on to the interest of the activity. Then motivation, our child is motivated, whether the child is interested in the session, all this matters. If the child is not interested in the session, definitely that don't expect the child to sit in a session for a long time. So now the task is making them very live in the sessions or the therapy centers, everything. So all this takes place in this pre-linguistic skills. Okay, next we can go for the next slide. uh, where's the next slide? Yes, we have this line. 1 minute, 1 minute. One minute. Yes, language skills, correct. Yes, language skills. There is a language skills, that is a receptive language and expressive language skills. I have already explained. Receptive is nothing but comprehension, and then once when the comprehension takes place, then next is a expression language takes place. So these are the like we have this language skills like to follow the simple commands, understanding receptive language skills and express like to follow the simple commands. Very first initially it takes place. Then we have something called as pointing the lexical categories and its items. For example, pointing out to the objects. We are in when this pointing means it takes place right from we start from the daily basic things what we come across every day, the common objects like fan, light, then eatables, vegetables, fruits, then car, vehicles, etc. So all these things we teach them the first in the areas of lexical categories. First thing is pointing. Why pointing? Because understanding comes first. Once when there is understanding, the very immediate next step is expressive language. Then the semantic level, that is a naming. You can go for a next slide. There is I have explained. Yes, we have this naming. Naming also takes place in the semantic level. So we naming of all the items what has been taught in the lexical categories by pointing, and all those have been taught, and they are said their names have been said. Next, we go for a language is like opposites. We teach them the opposites: smooth, hard, big, small, and we have this annexed action words. Then we go for a plurals. Then tenses. Tenses first is a present, then comes the past and the future, and then the past. Keep this in mind. Okay, next is we have the description. Next slide. Yeah. Then we have description and narration and conversation takes place at the end. This is how the language learning takes place. Next slide. Yes. Now, speech and language delay. What is delay? What is disorder, what is disability, and what is deficits. So this kind of a small confusions what most of us will be having, saying that my child is having a speech and language delay, my child is having a speech language disorder, my child is having some disability, and the child is my speech and language deficit. So let me clear with you all. Delay is nothing. When we say delay is nothing but a time. That means what is supposed to happen at 1 o'clock, it happened at 2 o'clock. That is nothing but a delay. Okay. What is supposed to happen from at the age of 2 years, it happened in the age of 3 years. That is a delay. Okay. The language development was supposed to, the child was about to say one word at the age of 12 months, but the child said it at the age of 18 months. That is a delay. Okay. And we have a disorder. Okay, so when it comes into a disorder, now what is this? This is a big area to be explained, the disorder or a disability and disease. Okay, but I can make it very clear that it is disorder is nothing but it is not a disease. Disorder is something which has to be function at a particular in a particular manner. It is not functioning in that particular manner. It is just deviated. It is not delayed, but it is deviated from that particular manner. That is how we can understand. Various definitions have come across, but try to understand disorder is something which has been bit deviated from the normal manner of functioning. Okay, next we have a disability. Disability is something which has been restriction, which has been restricted, or a lack of ability to perform an activity from the normal performance. Okay, it something which is not able to due to some of the conditions occurred for a individual, for a normal individual, I can say. That is called as a disability. And we have impairment and deficit, we call it as. We have this something called as hearing impairment, we call it as. In a cases of intellectual deficit, we call it as. In case for intellectual disability or we have this different terms saying intellectual deficit. Okay, so what is this? It is nothing but a loss or abnormality of psychological or a physiological or anatomical structure or a function. Okay, that is something called as an impairment or a deficit. Is it okay? Next, we can go from other next slide. Okay, who is this now? Speech therapist and speech language pathologist. It's very clear. I have mentioned and the first slide, speech therapist, right? Speech language pathologist, Rayaton D'Souza. Okay, so we'll provide the one who provides the treatment, support, and intervention services for the people with a speech and language disorder. Yes, we do provide this treatment. We provide this interventions services for the people who are having a speech and language disorders. Absolutely, he is a speech therapist. Apart from all those other areas of legal areas of certification and all, what we should know is the speech therapist is the one who gives the intervention those who are having this particular disorders. Please keep this in mind. Okay. Yes. And yes, I can add a few points about what the speech therapist, to be a speech therapist, what are the requirements. It should be a certified, it should be a qualified. After qualification, it should be certified. And the certification is from the Rehabilitation Council of India, who certifies the speech therapist to entitled to work in a Indian Indian places. Okay, India, sorry, in various places of India. Yes. Um, Now, more than that, whatever that's requirement, it also depends upon the experience. and how the knowledge and how informative the person is in how experience he has in the areas. Everything matters, and finally comes to the label saying that is a speech therapist and a speech language pathologist, a good speech therapist or a speech language pathologist. Yes. Next, we can go for a next slide. Speech. What is that? Yes, speech therapy. Oh, this is a good which I want everyone to discuss. Even they can come into a discussion to this uh, speech therapy. So parents also, it is, I think they can come into a discussion. I'll just go through this. After a while, I'll give a time for a discussion. Okay, because everybody has a different ideas. Considering my therapy in parents, I have come into this kind of a points where how the things should go on and how I decided. It is my personal opinion. First thing, when we think about the speech therapy, every parents will think about first thing they go for a selection of a therapy setup. Okay, I which where to go, that is the first, which therapy, which center to visit is a first idea. So we don't know which center, who is the person, unless and unless somebody refers us. Yes, then what we do in the very next step is we gather the information, or what we gather the information from each and individuals, like who is a speech therapist there, how is that place, whether that place has given some progress from the other kids. All those informations we now we go for a go for a Google's reviews, asking how is that place, how is this person, how is that therapist, etc. Next, we see once when all the information is seen, how the commitment of that person or the speech therapy center or a clinic is, whether those centers are very committed or not. This is the other thing what we think of before getting into an speech therapy assessment. Okay, why this is because most of places now, for example, if the child requires the everyday sessions, we have certain slots, but slots are not free. Then again, we are not able to give that service on everyday basis, but whereas the child requires on a everyday basis. Okay, so all this commitment has to be seen, whether it is a busy schedule place or how it functions. Then we have need to go for an assessment. Then we'll go for an assessment. Yes, after commitment of looking after the informations and the commitment of the places, then we think of taking an assessment in that particular speech therapy place. Okay, so once when the assessment takes place, we has to answer the few information, and I request the information from the parents should be very genuine. It is not to be being proud of your child or nothing like that. It what the information, what the child doesn't have, the what the child is lacking, be thorough with it. I have seen most of the parents saying that my child sometimes have seen him doing this, but sometimes no, let it be accurate. Yes, my child is not doing that. There is nothing to, because we are visiting for the progress of our child, and definitely yes, we need to be very genuine with whatever we the during the assessment time. Okay, once when we give a proper assessment, then the diagnosis takes place. After diagnosis, a big counseling takes place, and then we go for an intervention and the treatment. That is nothing but the speech therapy takes place. Next slide. Okay, and what are all things happening in this therapy sessions? Once when you get into the speech therapy, this thing you get into, first thing what you should have, all the parents should, or everyone should have, even from the therapist should have a faith with the child, or the parents should have a faith in the therapist or the therapy centers. The faith, confidence, and hope is important. Then you need to select for you need to think about the session timings and the slots, whether the child is sleepy, whether the child is comfort, etc. And the discussion of the therapy sessions, reports, selection of therapy session basis. Okay, these are all the areas what I'm talking now. It is very open for the discussion. um, your parents can ask me a direct questions on this. So when to discuss about the therapy sessions, preferably we say after the sessions. Then what about the reports? So most of us are keep asking for the reports, or whether the reports are very necessary, when it is necessary, and when the reports has to be taken from the therapy centers, etc. And the selection of therapy session basis. Okay, whether it is required on everyday basis, or when to decide whether it is required on a particular this, I'll be explaining during the discussion time. Next. Okay, next. Yes, we have this again, one more question is, what is the fees, then the parents and the child's cooperation and the interaction, the decision on therapy benefits and its outcome. There are some spelling mistakes. Okay, Decision on therapy benefits and its outcomes, individual and group therapies, what are its benefits. All these things we'll discuss in a discussion with the next slide. Please, can you make it open for a discussion?
Yeah, sure.
Yeah.
Participants, if you want to ask any question, you can simply unmute yourself and you can ask your question.
The previous slides, like from the 19, 20, 21 slides, you can keep presenting them so they can ask some questions on that.
Hello, good morning, sir. May I ask something?
Yes.
Sir, I am taking therapies from Mom's Belief from 1 year. My child is 4-year-old. He is autistic.
Okay.
Now he has started babbling and some humming sounds, but
Okay.
he has no sitting tolerance, so he never supports me in speech therapy. He never sits for at least 2 or 4 minutes at least.
Okay.
How can I stimulate him to develop speech?
Okay. Here, what you have said is what is this thing to develop the speech. As I already explained about how to develop printing speech, but can I come with some some of the remedies which I can explain you? Okay. Is that okay if I can explain you, because now already the 1 hour has been got over? Can I explain you if you can contact me?
Yes, sir. Sure.
Okay, because it takes a lot of time. I can just come out with the questions of speech therapy and how the therapy setups or the therapy session should be, when to decide all those things, rather than I'll explain you personally. Is that fine?
Yes, sir. Okay.
Okay,
It's okay.
okay. Yes. Next questions.
Okay. Thank you. Thank you so much, doctor, for this interactive and informative session. Also for joining with us today, and thank you all the parents and participants for joining with us today and making the session even more interactive. We hope you all have gotten your answers. Now we shall see you next time. Thank you. Have a good day.
Thank you.